We wanted to be able to make changes ourselves on the fly without having to escalate to a telecom engineer. So with this program, it's just a web-based, and any changes that we make, implement essentially right then and there. So we can change a recording, and we can create a call tree that we'd like to wait after hours, right? Because we don't know what that would happen with the current calls in the hold queue, or change hold queue times, change the hold music, all on the fly with the tip of our mouse.
Welcome to the Health Pilots podcast, presented by the Center for Care Innovations. This podcast is about strengthening the health and well-being of historically underinvested communities. Every episode offers new ideas and practical advice that you can apply today.
Hello, everyone. I'm Jessica Ortiz with the Center for Care Innovations. And today we're talking about one of the exciting projects that West County Health Centers has been working on for the past year. Our hope is that by sharing the highs and lows of this particular digital health solution, safety net organizations can apply the lessons learned here to their own challenges. I'm here with Summer Penn, who is a member of our Tech Hub Learning Network, which is comprised of 14 tech-forward California-based community health centers, clinic coalitions, and primary care departments in county health systems that are working to accelerate the adoption of innovative technology. We partner with our Tech Hub members to vet, pilot, evaluate, and spread innovative digital health solutions targeting Medicaid markets and historically underinvested communities. We are excited to bring you this story today. Summer, do you want to introduce yourself and tell folks a little bit about you?
Sure. Hi, everyone. My name is Summer Penn. I'm the IT director at West County Health Centers. I've worked for West County Health Centers for about 20 years. And my area of expertise is really around the EHR technology and anything that kind of integrates into it, as well as kind of more patient communications.
Great. And we're happy to have you, Summer. Tell us about the project you've been working on. How did you get started?
Happy to be here. Thank you. With the beginning of the pandemic, we realized really quickly that we did not have a phone system that could support the home office type work style that we had to quickly pivot to. We had implemented a few solutions that were with our current infrastructure and or required some staff to actually have to be on site, and then the combination of Zoom. But we realized really quickly that that was becoming a big gap in being able to support our users. And so we had to quickly pivot to a phone system, and we chose Dialpad.
And thinking about your solution, could you share with us a little bit more about the platform that you chose?
Yeah, Dialpad is a pure VoIP solution. VoIP stands for Voice over IP, which essentially means that the capabilities of this phone system do not rely on it being plugged into the data ports or a phone line that's on your wall. It can be used from any internet-based device. So we opted for only a few hardware phones, but for the most part, most of the agency does not actually have hardware phones on our workstations any longer. It is either a desktop application or a phone application that you can install on your smartphone. We wanted to be able to make changes ourselves on the fly without having to escalate to a telecom engineer. So with this program, it's just a web-based, and any changes that we make, implement essentially right then and there. So we can change a recording, and we can create a call tree that we'd like to wait after hours, right? Because we don't know what that would happen with the current calls in the hold queue, or change hold queue times, change the hold music, all on the fly with the tip of our mouse.
That's impressive. So you don't have to wait. There's no time in between. Just
no time in between.
Decisions.
Any feedback? We got a feedback on our hold music. Actually, we got a few complaints, but then also was on our surveys that we review. I thought it was a funny song. It was basically, I don't know if you guys heard it. It's that "I'm on hold" song. Doesn't really sound like a song. "I'm on hold." You should look it up. There's a YouTube video. At first, it just sounds like a lovely guitar song, and then the lyrics are just talking about how he's on hold waiting for his friend.
Well, I've been sitting here all day. I've been sitting in this waiting room
to join, and that was apparently offensive to some people. So, which I can see in a moment where you're not feeling good and you're frustrated, it could not have the intent we were expecting.
Yeah, and we all don't share the same love of each genre of music.
True. Yeah. Yeah. So we quickly changed it to a very nice, almost meditating type melody.
What was that vetting process like when deciding? At TCI, we have a framework we suggest, which is making sure there's a mission fit, operational fit, and sustainability of using the platform. How did this play into your decision making?
We usually like to take a little bit longer in our vetting process, but because of the limited resources, we only vetted 3 different phone solutions. That was essentially the VoIP solution to our current phone system, which was Avaya at the time, and that VoIP solution was Top Hat. It did not have analytics or anything, and we would also still have to rely on our whole telecom engineer to do most of the supporting for us, as well as another phone system. I'm not recalling off the top of my head, but it was more of a local company, what the name was. The CIO who we were working with at the time had used DialPad at his current hospital systems, and with the analytics, and then this feature that essentially it listens to every conversation and transcribes. And then if there's a key word, we can actually build in an assist card to the call center for who's answering that call. So that call center representative has all the most current information in regard to that topic based on our programming of that assist card. So for example, if COVID testing was mentioned by either the call center agent or the patient, an assist card will pop up giving them hyperlinks to any outsourced websites that we need to refer to, like the SOCO emergency website, or even just a whole list of phone numbers and or clinic hours or our own internal information about testing that we could give to the patient right there on the phone.
Can you share your top highlights of this project so far?
The top highlight is actually that assist card. Before then, we had kind of, an antiquated Excel spreadsheet that was, or things lost in team channels that our call center would have to go digging through to find the most up-to-date information. And then, things get copied. There's always version control issues. So this assist card allowed for a real-time, basically place updates that we can keep updated because the information was changing on the fly pretty much weekly. And so it was one of the better technologies for us to implement at the time.
And can you use the assist card to help with appointment scheduling to ensure that the patient gets the right slot at the right time?
In a sense, it doesn't kind of give the ability to do like online scheduling or anything, but it does give, because we have very specific, we actually have what's called like kind of a scheduling Bible. And so it is, has every different tabs of, which clinics, which providers are actually taking new patients. That is always referenced unless you remember everything, but it took place of some of those kind of who is accepting new patients. We haven't built everything out on the assist cards. We were mainly playing with most of the COVID and any other type of pain points that our agency was going through. But essentially, we could create assist cards for all those things.
Could it be used to identify a triage opportunity?
Absolutely. Yes. So any kind of keyword that you're able to program, it's really just one keyword, but you can create as many assist cards as you want, will trigger an assist card to pop up.
In implementing this platform, what was the biggest challenge you faced?
Training and getting used to a phone system that you did not have a physical phone for. That was a huge challenge for our users. And it's just hard on staff overall to have a big change like that. I think if I were to do it again, I would have purchased hardware phones and just kind of made it same as usual, in the addition to being able to use it from home. But unfortunately, buying all new hardware for 300 workstations, especially phones, was pretty expensive. We're planning on potentially phasing that in future, but at this point, we're almost getting used to it. So there may not need to be as much of a need to purchase the hardware. that. And then telecom was kind of a newer technology that I was not fully proficient in, and porting of phone numbers and dealing with Comcast to port phone numbers to this new phone system was a bit harder than I had anticipated. An additional challenge was I'm not a telecom expert, and definitely learned a lot in this process. But we had an original go live date of around March 15th, I want to say off the top of my head. That was dependent on our port request, which is where we list all the phone numbers and the accounts they're a part of, to Comcast and ask them to release our phone numbers to this new phone system. Well, that request, we don't find out until 24 hours before the go live whether or not it was approved. And of course, there's the balance of wanting to communicate to staff and make staff aware, because as soon as that port request goes through, it is not easy to get it to revert back. So you want to communicate to staff with the intention that we're going to go live, assuming that the port request was going to be approved. And it was not approved. And it didn't get approved the next go live, which was about 3 weeks later. And it didn't get approved the next time. It wasn't until May 17th that it finally got approved. And that was after trying to understand why a phone number was not part of an account when we thought it was. It was just all these idiosyncrasies with telecom technology that I had no idea about during the time of. And so it was a pretty big challenge and frustrating to staff, but luckily it only really mainly impacted our call center staff because of the phone numbers coming in. All the rest of the staff were still able to use and learn DialPad because they were able to use it making calls out, and we could still mask we had the caller IDs that were coming out of DialPad forward to our main line. So if anybody did call out of DialPad in that kind of medium period, the calls would still be, if they just returned the call, would go to the call center with the phone system they were using at the time of. So it didn't allow us to kind of being able to forward internally because those calls were, on a whole separate phone system. But once those porting requests, and how I actually got over it was we decided to just pare down those lists. We had way too many numbers on that list, and we thought that was part of the problem. So instead of doing all at once, we focused on our main numbers that we know we use as direct lines and focused just on those, and then submitted the port request instead of trying to do every number within my contracts.
It sounds like you became the telecommunications expert, Summer.
Yes, I learned a lot in this process. It was, could laugh about it now, but I was pretty, it was hard during the time. Another challenge was not having enough call center staff since the pandemic. And essentially in the beginning, a lot of people like to assume that the problem was a new technology. DialPad was the issue of why the calls were not being answered. But in looking at the analytics and seeing how many representatives we'd have available for the call volume we were experiencing, we were able to determine and prove that the issues were not our new phone system, but in fact were the lack of staff and not having enough humans to actually answer the phones. So to mitigate that, we actually changed licenses, escalated a lot more licenses internally to be able to answer on behalf of the call center. It's an elevated license rather than a talk user. And so that the larger majority of staff for all of our front office representatives, not just call center representatives, and in addition to some of our MA floats, had the capability of jumping in during peak hours to help answer when our call volume was the highest.
Did the new phone system highlight changes that you needed, but perhaps were not so obvious first?
Yeah, it did actually. So it helped us determine that we needed a whole call tree for other things, so that we kind of had more calls for, especially with Zoom, right? Patients are trying to get onto their Zoom line. We were able to quickly create a department called Zoom Assistance, add that to our phone tree so that someone could press 2 for Zoom Assistance, and that would actually go to all the MAs, all the medical assistants of that site, including I've added all my the IT department so that we are available to also answer those calls for those patients. Because usually if they're calling that line, they need to be able to get answered and helped quickly in order to get to their appointment on time without impacting the rest of clinical care.
And I know you mentioned this before about COVID-19 and trying to focus some of that effort on this, and also the challenges of not being able to really get this program going, right, from a distance when you have folks working in other places. What were any other challenges associated with the pandemic during this transition?
I think it was not being able to have everybody in a singular place. We had to rely on our videos and making sure that the supervisors were sending those videos and how-to documents to their users. Honestly, I think the biggest other challenge is just how much is going on with the pandemic and how much stress that impacts, even just like the status quo clinic, right? It just adds in a whole other element. And so there's been a lot of changes, and it's kind of hard for staff to keep up with all the changes. And so since we're not all together, we can't, bring them into a room and make sure they're full focused. There's an element to Zoom meetings, and I'm sure this is everybody, but there's definitely some multitasking going on a little bit more than there used to be. So sometimes, your attention span can waver or wander. So I had a few office managers essentially admit to me that they, haven't really reviewed any of the training material. And I think one of my lessons learned would be to engage the office managers in the vetting process all the way through to make sure they were more cheerleaders about this new program that we chose, instead of more finding it of a nuisance of learning something new.
So how much training and orientation was necessary for existing staff? I know you talked about the challenges with that. I'd like to hear more.
Yeah, so we did an everyday leading up to the go live. We did everyday lunchtime webinars for anybody who could attend for about 2 weeks, actually leading up to our go live date. And that was just for the regular talk user. And then we also held separate webinars for call center folks because it's a slightly different use case depending on your license. We recorded both of those, and we have those trainings and videos embedded in our new LMS system so that every new user gets assigned this course and they get a certificate at the end of the course that's been completed.
And what is LMS?
Oh, thank you. Learning management system. So we use Compliatric, and that's where we assign all our courses for the HIPAA, bloodborne pathogens, et cetera, et cetera. And with this new system, we actually have the capability of creating our own learning management courses. So we can upload and create our own and then assign it to users and actually kind of schedule anytime we want, how often do we want it to be done annually or every 6 months? So we have the capability of automating that training if we want them to do it every year, for example.
How has this platform impacted sensitive services like behavioral health? Could you use the new system to augment understanding patient needs?
So not every line do we have the transcription enabled for. We only have a transcription enabled for calls coming in through the call center. So we don't have that technology turned on for our behavioral health line, which is actually a separate direct line. And we asked all staff to actually disable, and we did, we go through and do random audits of making sure that those staff have that feature turned off for outbound calls. That assist card only works when the calls are coming through a call center itself, which is our 3 primary care lines. So Occidental Area Health Center, Russian River Health Center, and Bravenstein Community Health Center.
And you're part of our learning network. Mm-hmm. And we're big believers in collaboration and not reinventing the wheel. And you're part of this Tech Hubs program.
Yeah.
How did your peers in the program support and help you push this project forward?
I love having a place that I can go to and ask my peers questions that I don't actually feel stupid about asking. And, even if, could be a dumb question to someone that, but telecom is a whole separate technology that many IT directors actually are like, yeah, that's a whole separate technology. And so it's kind of its own little niche. But I love being able to ping ideas to my peers, or even just, emailing them on the side and saying like, hey, have you gone through this? For example, The transcription is also like a recording. It actually records the phone calls. So I had to ping my California folks because, California has that mandate of anytime a phone call is being recorded, it has to be a two-party consent. But did find out that as long as you're actually including that message when a user calls, right? So part of our greeting recording saying, welcome to West County Health Centers, for quality assurance and training purposes, your call may be recorded. That, and by continuing on with that call, is considered a two-party consent. So I was able to gain that insight thanks to reaching out to my peers.
Yeah, it's such a great community of folks that share so openly. And with this discussion, we're thinking about how to share some of these lessons with the broader community. And so any advice you have for listeners that are thinking about implementing a similar technology?
Yes, actually, we didn't do this in the beginning, but I'm so glad that we did it. We used Lucid Chart, but if you have Visio, you can use Visio. But we actually drew out every single line and the path that a patient goes through, even naming anytime there's a recording given, we put that name in there, as well as essentially the choice options, the treat options, and the path. So listing that out, and we're actually about to make that information transparent to all of staff, because we realized that was we only know about these Lucid charts within my department and within the executive team, but really the large majority of staff don't. We've recently spun up a SharePoint site. So we're building out a SharePoint site specifically to DialPad so that we have all of our training resources, our FAQs, as well as having a OneNote notebook dedicated to essentially the call tree and the systems there within, as well as being able to listen to the recordings without having to call each line, right? And kind of become a secret shopper. You can actually there's a hyperlink to our OneDrive folder where we stored all of our recordings and the scripts for those recordings. So one would be able to go there if they were curious.
Trying to make things that are complicated as accessible as possible, right?
Exactly. Yeah. Like, for example, I don't think our clinical staff actually know we have a Zoom assistance line, right? So we implemented that with our office managers based on the calls that were coming in. But I don't recall us really kind of, sending a communication or making that information transparent, which I could see being really helpful for clinical staff to know, like, hey, if you're talking to a patient and they have hard time, getting onto your Zoom appointment, you can dial 2 to get to our Zoom assistance line, for example.
Yeah, it sounds like a lot of planning for that to roll out and continue to be accessible for folks. It sounds like much of this was driven by necessity. Would you advise others to do this voluntarily, given the outcomes you've seen so far?
I would go to a VoIP system. Whether or not I would have gone to DialPad, which definitely we're finding has its quirks, I think I would probably want to vet more VoIP systems before we were to make a decision and have that be a longer vetting process in the future. But I think a VoIP system is the way to go, including kind of moving most infrastructure to the cloud.
Thanks so much, Summer, for sharing your project, your expertise and experience with the broader communities that can learn from what you all have done with this and how to potentially adopt this technology. I'd love to hear what's next for you.
We are actually rolling out, we're in the build phase, almost test phase for rolling out Luma Health as our new patient engagement communications tool. So we're going to be all of our text messages, bidirectional secure texting, intake forms or e-forms, e-consents, email reminders, broadcasts, everything will be done through the new Luma Health system. And we're pretty excited about that.
It's been great to have you on the call, Summer. Thanks for sharing, again, your expertise and your experience and being a valued member of this Tech Hub learning community.
Thanks for having me. It was a pleasure.